Good morning, sir. Good morning, everyone. I am Jenny Marie A. Amat from BSN 32B. For my assigned topic, I will going to discuss blood transfusion and parenteral nutrition. So first, let us define blood transfusion. It is a process of transferring blood products into one's circulation intravenously. Yung objective po ng blood transfusion is first, to increase circulating blood volume such as pagkatapos ng surgery, nagkaroon ng trauma, or hemorrhage. Second is to increase the number of RBCs and to maintain hemoglobin level such as sa patient na may severe anemia po. And lastly is to provide selected cellular components such as replacement therapy katulad ng may lack of clotting factors, platelets, or albumin. Now, for the nursing intervention, these are some important things na need nating malaman. First is to verify doctor's order, yung time that the patient need to be transfused ng blood. Inform the patient also and explain the purpose of the procedure so that the patient is aware before mag-sign po for the informed consent. Then second is to identify client properly. There are ways to identify patients such as pwedeng ipastate yung name or age and check the wristband. Third is to check for cross-matching and typing katulad ng ABO group or RH factor para ma-ensure yung compatibility. Naglagay po ako ng picture sa side para maalala po natin yung pwedeng mag-match sa recipient ng ABO group system. Bali yung kilala as universal donor is si type O po, tapos sa universal recipient naman is si type AB. Kapag sa RH factor, ang tatandaan po natin, kapag RH positive, yung pwede pong maging donor niya po is si RH negative at si RH positive. Pero kapag RH negative, ang dapat lang po sa kanya is RH negative lang din po. Fourth is to obtain and record baseline vital signs para maging basis kapag nag-administer na ng blood. After 15 to 20 minutes is mako-compare if nagkaroon ba ng increase sa vital signs. Then fifth is to practice strict asepsis to prevent contamination. Sixth is to check the label of blood transfusion such as yung nakalagay sa picture, the serial number, then the blood component katulad ng red blood cells, then blood type such as yung AB na nakalagay, RH factor which is positive, yung expiration date such as January 22, 2007. For the screening test naman, it is important because need nitong ma-ensure that yung blood is free from blood-carried disease, which is therefore para safe kapag i-transfuse sa patient. Yung tatlong disease na under dito is a syphilis, yun yung VDRL, and the hepatitis B surface antigen and malaria smear. 7. We need to warm the blood at room temperature before transfusion para ma-prevent yung chills of patient. Then 8 is use needle gauge 18 to 19 to allow easy flow of blood. And may nabasa po ako kapag maliit or hindi enough yung large enough yung gauge na gagamitin is yung RBC can break or lyse. Then 9, we have to use BT set with special micron mesh filter to prevent administration of blood clots and particles. Dun po sa picture, yan po yung example ng BT set na if izo-zoom nyo po, merong naka-indicate po na chamber with filter. Dun po makikita yung micron mesh filter. Then 10, we have to transfuse the blood slowly at usually 10 drops per minute. Yung rationale why we need to infuse slowly para ma-minimize natin yung amount ng blood na marireceive ni patient in case na magkaroon ng possible transfusion reaction. We need to remain also sa patient side for 15 to 30 minutes para ma-observe yung adverse reaction na usually nag-occurs during first 15 to 20 minutes. Then 11, we have to monitor the vital signs for altered adverse effect reaction such as merong increase ng temperature and the respiratory rate. 12, Do not mix medication with blood transfusion to prevent adverse effect. Do not use blood transfusion line for IV push of medication. Need ng ibang site for medication. Then 13, administer 0.9 sodium chloride before, during, or after blood transfusion para ma-flush yung tubing. And never mag-administer ng IV fluids with dextrose. Kasi po, pwedeng mag-cause yung dextrose-based IV fluids ng hemolysis. 14, we have to administer blood transfusion for 4 hours. Usually po hanggang 2 to 4 hours po lang pwede if i-transfuse yung blood kasi po may risk for contamination kapag mas matagal. For plasma, platelets, and cryoprecipitate, transfuse quickly at least 20 minutes. Yung floating factor kasi can easily be destroyed. Then 15, we have to observe for potential complication and notify physician para mag-order ng any medication if magkaroon ng complication, which is madidiscuss natin mamaya. These are the examples of complications. Merong 5 po, which is first, allergic reaction. Ito po yung nag-occur kapag yung patient is sensitive to plasma protein ng donor's antibody, which is nagre-react sa antigen ni patient. Then 2, we have a febrile or non-hemolytic. It is caused naman po ng hypersensitivity to donor white blood cells, platelets, or plasma proteins. Ito yung most symptomatic complication of blood transfusion such as merong sudden chills and fever, flushing, headache, and anxiety. Third is septic reaction. It is caused by transfusion of blood or components contaminated with bacteria. Kaya important na i-maintain yung aseptic technique during transfusion. As much as possible, every blood bag transfusion, mas magandang palitan yung IV tubing para ma-prevent yung growth of bacteria. Fourth is circulatory overload. It is caused by administration of blood volume at a rate greater than the circulatory system can accommodate. Ito pwede mag-occur since nag-introduce tayo ng fluid sa body. So as much as possible, we need to monitor yung output ni patient and observe for signs such as edema. And lastly, hemolytic reaction. It is caused by infusion of incompatible blood products, which is possible na mangyari if hindi maging vigilant yung nurse sa pagve-verify ng patient's identification at the beginning with type and cross-match samples. For the nursing intervention, if ever mag-occur yung complications, first, if we have to stop the transfusion immediately. Then second, we have to start IV line of 0.9% sodium chloride. Third, if nahihirapan huminga, i-place natin si patient in Fowler's position and administer oxygen therapy. Remains with the patient for observation of signs and symptoms and monitor vital signs every 5 minutes. Fifth, we have to notify the physician immediately for pharmacological interventions. 6, the nurse prepares to administer emergency drugs such as antihistamine para ma-decrease yung immune response, vasopressor to help open airway, fluids to flush out free hemoglobin, and steroids which suppress immune system as physician's order or protocol. We may also have antipyretic for fevers. And 7, we have to obtain a urine sample and send to the laboratory to determine presence of hemoglobin as a result of RBC hemolysis. Then 8, blood container, tubing, attached labeled, and transfusion record are need to be saved and returned to laboratory for analysis. Now, let's go naman po for the parenteral nutrition. It is defined as a method of providing nutrients to the body via IV route. Katulad po nung hawak ng nurse sa picture. The nutrients are complex mixture ng proteins, carbohydrates, fats, vitamins, trace minerals, sterile water, and electrolytes katulad ng calcium, phosphorus, magnesium, and sodium para ma-maintain yung electrolyte balance and makatulong sa pagtransport po ng glucose and amino acid across cell membrane. The goal of parenteral nutrition are similar to the goals of enteral feeding, which is to improve nutritional status, establish a positive nitrogen balance, maintain muscle mass, promote weight maintenance and gain, and enhance the healing process. For the indication, important po na before mag-proceed sa parenteral support is i-consider po muna yung enteral nutrition method kasi po it can maintain the gut mucosal integrity and mas na-improve yung immune function ng patient, and aside from that, mas konti po yung complication na makukuha through enteral feeding. Yung parenteral feeding is advisable if the person is unable to ingest adequate oral food or fluids within 7 to 10 days time frame. Meron pong for example of indication na pwedeng i-considered for parenteral feeding. First is the insufficient oral or enteral intake, halimbawa po ng may severe burns, malnutrition, acquired deficiency syndromes, sepsis, and cancer. Second is impaired or inability to ingest katulad ng may paralytic ileus, Crohn's disease, post-radiation enteritis. Third, patient unwilling or unable to ingest adequate nutrients orally or enterally, like having major psychiatric illness katulad po ng may anorexia. Then fourth, prolonged preoperative or postoperative nutritional needs katulad with extensive bowel surgery and acute pancreatitis. Next is the administration method. There are two types of administration method. First is through peripheral method. PPN is given through a peripheral vein, which is the solution is less hypertonic than a full calorie parental nutrition solution. PPN formulas are not nutritionally complete because of their low dextrose content. Based po sa nabasa ko, dapat kapag via peripheral route, yung dextrose concentration is not more than 10% formulation. Kasi po, if more than 10%, it can irritate the intima of small veins or innermost walls, causing chemical phlebitis. Yung usual length ng therapy using peripheral parenteral nutrition is 5 to 7 days. Then the second type is a central method. Yung solution po na binibigay through central parenteral have 5 or 6 times the solute concentration of the blood. Yung osmotic pressure po is about 2,000 osmolarity per liter, which is mas hypertonic yung concentration niya compared sa peripheral. It is given into vascular system through a catheter inserted into a high flow large blood vessel such as at superior vena cava or right atriocaval junction. Mas mabilis pong madilute yung concentration solution in these vessels. May ibang types po ng central venous access na available, which is 4 po. And for the parenteral nutrition administration, these are some important things that we need to know. First is to review physician's order, check the date and time of last TP and tubing change. Then we have to ensure the rate of infusion is verified sa doctor order each time na bago yung TPN bag. Then second is to collect supplies, prepare TPN solution, and prime IV tubing with filter as per agency protocol. Third is provide hand hygiene. Fourth is to complete all safety checks for CVC as per agency policy. Fifth is to start TPN infusion rate as per physician's order. Prevent error, and aside sa pag-check ng infusion rate, need then i-inspect yung solution for separation oily appearance, or any precipitate, which is known yon as cracked solution. Kasi kapag may presence ng white crystal or oily appearance, dapat hindi na po gamitin. Then sixth, we have to discard old supplies based on agency protocol. 7 is to monitor for signs and symptoms of complication, which is mention po sa next slide. 8 is to complete daily assessment and monitoring for patient. Then lastly, document the procedure in the patient's chart for legal purposes. Now let's go to the complication of having parenteral nutrition. First, merong pneumothorax. Second is air embolism. Third is clotted catheter line. And lastly, catheter displacement and contamination. Naka-indicate na din po yung cause and possible treatment from the complication. For the discontinuing parenteral nutrition. So, ito po yung mga dapat natin gawin kapag i-discontinue na po yung patient into parenteral nutrition. First is do not abruptly stop kasi po may tendency na yung body is magkakaroon ng hypoglycemia, which is dapat gradually yung pag-stop para makapag-adjust yung body, and pwedeng mag-administer ng isotonic dextrose, same rate ng PN solution infusing for 1 to 2 hours. Need i-monitor yung patient from rebound hypoglycemia. Yun po yung naka-indicate dito sa side na mga symptoms po ng hypoglycemia such as weakness, faintness, sweating, shakiness, feeling cold, confusion, and tachycardia. Next is to give isotonic dextrose such as yung na-mention ko po kanina na reason. Next is to put dressing to the site since open para ma-prevent yung infection. And lastly, kapag surgically central catheter and implanted vascular access port are tatanggalin, only the primary provider can remove it. That's all. Thank you.